Do you want me to open it up? Okay, so we're going to open up and begin our joint Cuyahoga County Health and Human Services and Aging Committee, along with Education, Environment, Sustainability, today, Wednesday, October 30th, 2019. Can we have a roll call, please, Madam Clerk?
Calling the roll for the Education Committee, Ms. Simon?
Yes.
Ms.
Here.
Brown? Here. Mr. Jones?
Here.
Ms. Stevens? Ms. Stevens is absent. Mr. Brady?
Here.
There is a quorum.
Thank you so much.
I'd like to call to order the Health and Human Services and Aging Committee. Can we have a roll call, please?
Calling the Health and Human Services Committee, calling the roll, Ms. Conwell?
Here.
Mr. Jones?
Here.
Ms. Brown? Here. Mr. Miller?
Here.
Ms. Stevens? Ms. Stevens is absent. There is a quorum.
Thank you. Anyone in for public comment?
No, Madam Chair, no one is signed in.
All right.
Okay, so there's no matters referred to committee. Today we're here to get an update from Milestones Autism resources, and want to ask for Alana to come up, please, the director. Are we ready, Madam Clerk? Good. Okay, thank you. So welcome. Can you identify yourselves, please?
Thank you. I'm Ilana Hofferskoff. I'm the co-founder and executive director of Milestones Autism Resources. I'm here today with Beth Thompson, who is our program director.
Thank you so much. You were here last year, I think, around this time, and gave us an update on how the allocation that you received has been used, and we will welcome you to give us a further update and let us know what you're doing.
Great. Thank you so much for the opportunity to meet with you in person. We are grateful for the support for our free help desk. Let's see. Just to start off, is it okay if I move this so I'm closer to the computer here? Okay. I feel more comfortable. You guys do this every day. It's new for us. We do have packets for you that I'll give out afterwards, and I'll make reference to the items in the packet. Milestones was founded in 2003, and our focus is on education. At the time in 2003, it was before there was a clinic school. It was before there was a monarch school. Many of the school programs in the public schools did not have specialized services for autism. A lot has changed since we founded the organization. There is much greater awareness about autism, and yet with more and more information out there, it's still very confusing for families. It's a very confusing diagnosis. There are a lot of things to think about and to address, and what Milestones is here for the entire community, for parents, for professionals, as well as for the individuals with autism themselves, to be a clearinghouse of information, to be a trusted resource. Milestones is an independent organization, and individuals can call from throughout our community, and they do, so that they can speak to a professional at our office and get information, clarification, suggestions, and be somewhat of a guide to them as they're traveling on this journey with autism. There's a lot of things that come up, sometimes medical situations, sometimes an inability to access resources. Sometimes there are other medical conditions involved with the autism. And so this is what's critical for families to have a place to turn to. You see in our vision, we are looking to support individuals with autism and celebrate their challenges, celebrate their strengths, and help families recognize what they can do in future planning for their child as they grow into adulthood, so that they can be active participants in the community and they can access the community, be engaged with the community. I know that the County Board of Developmental Disabilities has been here, and that's a primary role for them, is they want people engaged in the community. But the way we partner with the county board is that the county board delivers the resources so that people can access and engage in the community, and Milestones is helping by vetting the resources, by reviewing those resources, and helping to match people with the appropriate resources. So we work in concert with them, as we do with the other autism providers in the community. What's unique about Milestones is that we are serving the entire community, every age, every stage, every functioning ability. We serve all members of the autism community who are affected. So the person themselves, their family, the support staff, the professionals in the community, potential employers, the community at large. We get all of those calls to Milestones. We have a staff, full-time staff of professionals. That's also different than other parent groups in the community, which is wonderful, where you can speak to a parent, but when you're calling Milestones, you as a parent are partnering with the professionals who have been serving and supporting hundreds of individuals and have that scope of knowledge. As I said before, we're a neutral agency, so we're not referring you to our services per se. We don't have a school that we're sending you to, and we're really thinking about what's important for that individual, what's a priority for that family, what insurance do they take, what are some of their cultural and family priorities. So we are able to work directly with families in that way. The other thing that's very important about Milestones is our website. I don't know if we're going to have a chance to link. Do you have Wi-Fi connected here? Because in our slide, we do have a link to our website that we wanted to walk you through a bit. Okay. Our core programs, we have a national conference that's held at the IX Center. Our website, which we would like to walk you through. The free help desk, which is supported by the council, by the Human Services Committee, and we do offer consultations for families, but also trainings for providers in the community. We've provided trainings for the hospitals to support their staff. Beth can speak a little bit more to that in terms of our consultations and trainings. This is an example of our impact in the past year. 500 plus coached through the free help desk. It's really an interesting process for us. I'm going to turn over to Beth a little bit to talk about what happens when someone calls Milestones. What are the steps that are taken and how we're connecting them to resources.
Good afternoon. When a professional or self-advocate or a family member contacts Milestones, they get routed to a help desk coordinator, and her sole job is to do the intake and to figure out what staff is going to be the best match. So while we have staff dedicated by age, like early intervention or teen and adult services, we also have staff with other specialties. We have a staff that had 35 years experience at Metro Health in the comp care unit, so she deals with our medically fragile families and as well as a lot of our low-income families. So when a family member or professional gives us a call, they have probably about a 20-minute intake process where they're explaining what the issue is, and we're trying to learn the dynamics associated. Are they involved with their county board of developmental disabilities? Oftentimes they're not. What insurance are they trying to work with? Oftentimes it's Medicaid, and they may not be able to find an oral surgeon to take their adult child to get adequate care. So once they're assigned a staff person, that staff person talks with them probably anywhere from 30 minutes to an hour to learn a little bit more about how best to serve them. And the difference between our help desk and the traditional like 211, 211 will give you a list of resources. Our staff is going to actually talk you through how to access that resource. So it's not just enough to tell somebody you need to call the County Board of Developmental Disabilities. We have to tell them this is the language you need to say in order to start getting services immediately if the case is an emergency or they've never been connected to services or supports. So it's really helping them with that navigation piece, not just here's a resource. And another unique aspect about Milestones work is we actually do personally vet every single resource that we're handing to families. So we want to make sure they're evidence-based, and we want to make sure they have a reputation of quality care. And that's actually something the County Board of Developmental Disabilities and other entities that are public can't do. Their bylaws say that they cannot refer to specific providers because it doesn't create neutrality for them. So even if we have families well connected to the support systems that are provided in the community, they may not know which providers they can really trust. So that's where we connect them with the people and places that we actually know. And then we actually do 3 follow-ups with every single one of those 500 plus callers to make sure they got the support, they got the resource, and it's working for them.
One of the things that's important for us is for families to know that they are entering a community when they're calling Milestones. So they may start at the help desk, then they're introduced to the website, or vice versa. Maybe they start at the website and then they call our help desk, and they begin to be more comfortable so that as challenges come up, as questions arise, they can continue to call on us, and we can continue to help guide them through the age of their child into adulthood and beyond, and looking ahead and planning further for them. You'll see that we have trainings listed, 1,550 people through the trainings. Sometimes families will invite us to help their school team as well. And then 1,200 at the conference. That, again, is a more intensive opportunity for education. And once families find us, if they are interested in participating in any of our services, and we don't want finances to be a barrier, so we do collect funding from other sources to provide scholarships so people can attend the conference if that's appropriate for them, or if they need consultation. We're very interested in further engagement with the families. We want them to know that they don't have to wait for a crisis to call us. They can be calling us throughout the year, and we want them to, so that we can help guide them along the path. Each year they meet with their school team to develop an individual education plan if the child has those needs. They're not sure where to go. They're not sure what goals to include. That's a conversation they can have with us before they do that. They're looking ahead for camping. What would be appropriate? They want their child to have some recreational opportunities. We'll walk them through and talk with them about how to select. What are the questions to ask? Our goal is not to always hand them and take over the choices from them. We want to give them the questions to ask. We want to help them understand how they support their kids. We are certainly there as a partner in the effort, but there's ongoing education for the family so that they feel stronger in terms of how to support their children and they feel more empowered. They feel that they have a partner in this. They're not doing it alone. I think when you read about other families, a number one issue is the isolation that they feel. They can't go to a regular restaurant with their child with special needs. They can't go to the regular camp. Half their kids want to do one thing, and the child with special needs can't go to that. And it's a strain on the family. So the more the family can feel supported in the effort, it's much better, and there's more education. We want grandparents to know how to support, or aunts and uncles to know. All of this is a growing community with autism, and we want them to know there's a place for them. We've talked a lot about who we are and what's going on. We wanted to have at least one slide if there were any questions about autism. So I'm going to turn back to Beth for a second for that.
I'm not sure the familiarity level with ASD. It's a neurological developmental disorder that impacts 4 major areas of functioning. Probably most notable is their communication. I think most people are aware of that. Behaviors that are often repetitive. Also, their social relation skills, which is tied to their communication, and then sensory issues. And currently, the prevalence is 1 in 59, which is an increase as it's continued to increase throughout the past decade.
One thing that's very interesting about a person with autism is that they're really unique in and of themselves, and you'll see that autism impacts people very differently. Just in our office, we have several parents. We have a parent of a child who uses a communication device. We have a parent of a child who's working in the community with a job coach. We have a parent of a child who went to college and is now living in Chicago. So there's a huge range of abilities for someone with autism, and yet these 4 areas, everyone with autism is impacted in these 4 different areas, just at different levels. If you take the number of 1 in 59 and look at the estimated number of folks diagnosed with autism across that whole spectrum, again, as we said, that it can impact people different ways, you see that there's an estimated over 20,000 individuals diagnosed on the spectrum. And when you think about this autism community, you see that it impacts not just that family, but all those who are connected with them. So we want to make sure we address and thank you for the impact of the council's support. We have been very fortunate to be in the budget for 2 budgets, where the support has been coming, and a lot has happened to us as an organization because of this support, because we knew that we had this support going in for the free help desk. And again, I'm going to send to Beth to talk about the program and how the support from the council has impacted us.
One thing we're actually just really grateful of is that it's been a sustained service. This is not something that you can find in other communities and almost anywhere else in the U.S. is this very professionalized help desk that's completely free to anyone that gives a call. So not only are we proud of the growth that we've made since our first allocation, we're just very grateful that we've been able to sustain this service. We have been able to increase our expertise. We were able to hire somebody who has a master's in counseling and an extensive mental health background, as well as ran a very well-founded transition program in Southern Ohio called Bridges to Employment, which is a model that all of Southern Ohio uses. Hopefully it'll come up here. We were also able to hire an early intervention coordinator who is also a self-advocate. So he's an adult on the spectrum who has a master's in social science administration, who brings quite a lot to our staff, both as a professional and as a self-advocate. And we were able to actually make the help desk role a full-time job for a really dedicated mother of a child on the spectrum who found Milestones through calling our help desk and got the services, got a diagnosis for her child, got an educational plan through working with our early intervention specialist, and recently joined our staff as our full-time help desk coordinator. So she actually came out of one of our help desk calls. Throughout the past few years, we have been able to greatly streamline and professionalize the services. It truly was just me and the few moms at the agency handling all of these calls. So we've been able to go down from 2 weeks' time. It usually took us 2 weeks to get back with resources to somebody, to our max now is 5 days. Typically in 2 days, we'll get the resources to the family or the professional that they need. And our website, as well as all of our staff, have really, really tremendously increased our awareness of resources in the community. And as Alana mentioned in the beginning, there's just more resources in general. So we have quite a large vetted list of resources in almost every category possible for our families. And if we have the opportunity to see our website, you'll see how nice and user-friendly it's organized so that, as we've alluded to, parents don't feel the need to wait to, have a staff give them the call back. They now have some of the tools that they know what questions to ask, where to go, and they can actually go to our website and start doing some of that work that they may have done with a help desk staff when they first called.
Another thing I want to mention is having the support of the Cuyahoga County Council through this Health and Human Services Committee has given us the opportunity to speak with others in the community to match your support, so that we are able to talk to the Cleveland Foundation, the Mount Sinai Healthcare Foundation, and show that we have the support of the community for this effort, for this community resource, and they were able to also support, because it's an expensive proposition to have a free service for the community, and knowing that this is supported by the Cuyahoga County Council meant a lot to the foundations and then to other family foundations to also join and partner with the council, so that the council's not doing it alone, it's doing it with other partners in the community. This is our new website, which we're so proud of, and we want to walk you through a little bit. There is a link, so we're going to try that. What I want to mention is we have been growing over the years since 2003, continuing to grow all of these resources, and it became overwhelming for folks. They weren't able to find everything. So we wanted to make it very easy for people. We also wanted them to feel a more personal connection when they're coming to the site, that they know that there are people behind them. There's a phone listed there on the bottom there where it's an easy access. You can immediately contact the help desk that way. We wanted people to identify themselves and say, I am a parent or a teacher or a professional in the community and I'm looking for help with, for example, challenging behavior, and then they get sent immediately. So I'm going to click it and see if it'll get to there. Aha, here it is.
Okay, so on our website, we have all of our services listed separately than our actual resource center because the resource center is so extensive. So some of the tools that Alana was referencing are attached to our resource center. So it's not just enough to give somebody a list of resources. You have to tell them what questions to actually ask and a way to keep track. And then some educational toolkits that are actually written for the local community. So it's not talking about something that's not relevant. It references services within Northeast Ohio. But I want to show you an example of a guiding question. These are all written in partnership with other professionals in the community. So say we have a family that's looking for a new doctor. It's not just enough for us to give them a list of every amazing professional at Metro or UH or the clinic. So we've created these fillable guiding question documents where parents or whoever might be calling can use it to keep track of all the resources. So we're coaching them on what questions they should ask and providing a place for them to keep all that information together and organized. Because as you know, if you are trying to find something, you've talked to 3 people, you have no idea which one is like on West 9th and which one takes that insurance. So it provides them a way to help feel more organized when they're trying to pick the right resource for their child or themselves. And we have those guiding questions for the majority of our frequently asked questions. And then I'll show you the resource center. Okay, so our resource center is divided by the most frequently asked about categories and then broken down by age and a whole lot of other fun things. So anyone have an interest in any category? County. Okay, so this is going to be on the left side. You see our county specific. We had an opportunity to work with some partners in Ashtabula County, which is just really lacking in resources. So we wanted to make a concerted effort to get some up. So we have the ability to mark whatever, for this category, whatever county or area we want to. And then we can filter by the age or by the audience. And then we can actually have a zip code function. Oh, Alana was just saying, where's Cuyahoga? Cuyahoga's everything else. Cuyahoga has the most amazing resources in our state. Cleveland's actually in the top 10 cities to move to if you have a child on the spectrum. One of that reasons being we have the most resources. So our resource center that's composed of over 11,000, about 10,000 of those are based here. We're based in Cuyahoga. Let me just do I don't even know I was trying to think of Ashtabula. Right. I'm going to pick another category. Really? You're good? So that you can get a sense on how much the parents can truly narrow down the resources they're looking for so they can get very, very specific information that's drivable to them and meets the age requirements of their kids. Any questions about the website? Okay, I think they're good. Just go back.
While you're doing that, for those families that are digitally divided and do not have access, I'm sure they call into your help desk. So what do you recommend for families?
The largest population that are technology lacking would be our grandparents. We have a really significant amount of grandparents that are the primary caregivers for their grandchildren. And we do a lot of mail hard copy papers, and we I mean, we don't even encourage them to like go to your library and look it up. Like we just talk to them on the phone and do hard mail with them, or have them come into the office.
So you have most of this stuff printed out for?
Yes. Yeah. Yeah.
Certainly all the toolkits are in a PDF format so that it's easy to print, and we do that for them. And all the guiding questions you see, they're in a document, so it's easy for us to do. The other thing on the new site, we can click favorites so that in the conversation with someone, and as we make the recommendation, we're working on being able to print for them the list that we've discussed and then send it to them.
Okay, thank you.
Selena Miller was going to be here today with us today, but unfortunately is ill. We were really fortunate to have some amazing, really strong advocate moms come through our help desk. So we noticed about 2 years ago, we had an increasing amount of specifically African-American moms calling and saying their kids were not getting behavioral plans when they were having challenges in the classrooms. They were getting punishments. And they were noticing that they weren't getting the same diagnosis and the same treatment when they were going to their medical providers or therapy providers. And it was an ever-increasing issue that we felt like we needed to dedicate some time to. So we began a diversity task force 2 years ago with some really phenomenal community partners trying to address this issue. We know that there's a gap in diagnosis. We know that that then means late start to early intervention services or no early intervention services. And then those children of color are often starting off school on a later foot than their white counterparts, and then further getting punished for behaviors that are a result of disability. So we, through a variety of funding sources, were able to hire Selena Miller, who actually was already in the community leading the only parent support group that and composed primarily of mothers of color who had children on the spectrum. So we actually found Selena because we were referring our families to her through help desk. And all of these moms that were calling with all of these really challenging cases were finding support and advocacy in her support group, and we wanted to bring her on in this effort. So we recently hired Selena, and she is doing a lot of work to improve our outreach to communities that we've traditionally not done outreach to, which is, again, increasing our help desk calls from those communities, which we're very grateful for, but it's leading to another, increase of callers with other distinguished issues. So she's very sorry she can't be here today. This is actually one of our initiatives. We are trying to do more education about this issue of the gap in diagnosis and the gap in intervention. This is a panel of self-advocates. The 2 young men are individuals on the spectrum, and the 2 women are parents of children on the spectrum. And this was a workshop that we did at our conference this year where they talked about their experiences and how they might be distinct or different than their white counterparts.
The task force is led by Nicole Cruz, who is also our board chair. And we have other board members on that committee, the task force. Others besides parents are professionals in the community serving communities of color. We have from Cleveland Schools. Selena also, just a little bit about her background, she's actually a parent representative for the Warrensville School District as well. One of our initiatives through this project is being funded by the Begun Foundation to support training of first responders to interact with individuals with autism, as well as the self-advocates themselves. And we're targeting 2 communities, Warrensville and Garfield, with pilot projects for this effort. And we wanted to raise it today because it came through the help desk. We were responding to a need that came through the help desk, and it impacted us as an organization. It led to the conference discussions and presentations, and then led to our ability to seek funding to hire Selena and really expand our efforts. This is just a smattering, really, of different partners that we work with throughout the community. It's actually not everyone, but we wanted to show you a variety. In terms of government, the Cuyahoga County Council is basically our only funder. We actually got this year for the first time $2,000 from the Ohio Department of Developmental Disabilities, but that's it. We have specific partnerships with the schools listed, and we're working with a variety of agencies, universities, foundations that you can see. Milestones has a board of directors, which includes individuals who are directly affected by autism, their family members, professionals working with autism, as well as community members. I think by having the different partners together, it's really helped keep us grounded. It has helped us be a resource for the entire community. On the board, as well as on our own staff, we have individuals with autism, so we're giving a voice and hearing directly from individuals who are affected. That has really been a wonderful thing for us as professionals, as parents, to hear directly from people with autism what their experience is like. And having them in the workforce as well has been helping us as an agency be much more responsive. I think their own perspective has helped us in terms of how we present our services and how we support people in the community. I'm going to turn over to Beth to share testimonials from parents and professionals who access the help desk.
This might come as a shock to you, but a lot of our partners actually use us for a lot of the work that they need done. So we actually get quite a few calls from the hospital care systems asking for resources that they may not be familiar with, or asking for us to try to help navigate that family, even to the point of we've helped University Hospital navigate the discharge plans for when an individual has to go home and may not be safe in their home community. And we've assisted their social work department a great deal with looking for resources in the community that they're not familiar with. And we've actually had an opportunity to do a lot of training and in-depth partnership with university hospitals to try to help their how they handle patients on the spectrum when they're in for inpatient care. And really remarkably, we're able to take their rate of children being put in a 4-point restraint, unable to move, from about 70% to beneath 50% in 2 days of training while we were there. So we're really proud of our work and have a really great relationship with a lot of the professionals, and just wanted to use Dr. Sostracker as one example. And then this is Patricia Parker and her son, and I just wanted to give an example of a help desk call. Patricia really felt like she couldn't trust anyone when she called us. Her son had been in a day program. Her son's fairly impacted and can't work in the community, and he had been abused there. So she had pulled him out and was keeping him at home and wasn't working, and didn't feel like there was any place she could go that her son would be safe. And I actually, in the process, this was actually one of my help desk cases, in the process of working with her to find a new day program for her son, connected her to Mother and Selena Miller. Now she's a part of that support group as well. But we coached her through. These are the places that we know they're safe. We know they're doing quality work. I arranged a private tour for her at some of the day programs that we trust. And now her and her son are very happily at Monarch Adult LifeWorks. Located very close to here. And she now feels like she has a community. She now feels like she has a safe place to send her child, and she feels more like an advocate. In fact, one of the day programs that she went to, it wasn't the right fit for her, but she was so amazed by what they were doing there that she's actually on their advisory board now. So she's become a leader in the community and went from a place of feeling very scared and not confident, and now she feels like she has the ability to coach other parents too.
I think it's hard to share numbers with you. We're trying to share stories with you, and these are all individuals that we get to know and try to help on their journey. And you can see they're all different and all different ages. They have all different abilities. And I think the purpose of having Milestones is having families recognize that there is potential for their children. One of the things that we heard from a mom from Fairview was that talking to Milestones helped her understand there were all sorts of possibilities for her child that she never had dreamed of when she first got the diagnosis. And for us, that's what we're trying to do, that each individual has strengths, and we want to help the families unlock them and help schools work in a way to support that. And our role is to help all the other agencies as well as the families. We're helping the other agencies by letting people know about them, by providing training for them. We're helping to connect them with the families who want the information. So we see our role as a connector throughout the community. I wonder if you have any questions for us? Yeah.
Just was wondering, is the cost going down for families with autistic children? You know, it was very expensive.
I haven't seen any new reports. Probably about 2 years ago, I was actually working with an attorney, and we had to estimate the cost for care for an individual, and it was over $1 million for the span of their lifetime. And I haven't seen that decrease at all. I am very grateful. The state of Ohio actually did increase the Medicaid waivers that are going to come out, so that's a tremendous help to our families, but it does only pay for, a portion of what they need.
Okay. Thank you.
Councilman Jones. Thank you.
Thank you, Madam Chair. When you mentioned the gap in diagnosis and resource services to the minority communities, you mentioned that you were partnering with CMSD, Garfield Heights, and Warrensville Heights. How long has that partnership been in existence?
CMSD has been for quite some time. I would look to Lana or her back. Maybe I would say at least the 10 years that I've been with Milestones. Warrensville Heights and Garfield Heights actually just began this year. We moved into Warrensville Heights, Milestones did. We relocated from Beechwood to Warrensville Heights about 1.5 years ago and have started to build those relationships. So we're working with the first responders, and we're also working with the school districts.
Okay. Many times we work in silos. In Warrensville and Garfield Heights particularly, and CMSD for that matter, there is the county funds linkage coordinators who are there, who actually play a similar role as to the good work I'm hearing from you today. They help children that not get suspended or given detention, but actually figure out what's going on, and that has helped improve the graduation rate and the attendance.
One of the things,
Are you familiar with those linkage coordinators?
yes, and I'm very grateful for them. And we've been working actually most closely with the transition coordinators at both of those schools, and actually working with where does Judith come? What is Judith from? Where's her? What is her department?
I'm not sure.
That's
She
our
does the translation, right?
Yeah, she does all of our translation services. I'm not sure what department she comes out of. One of the things that we have learned for both Warrensville and Garfield, that diagnosis thing is really, really late. So there is a really small amount of kids that actually have a diagnosis of autism in both of those schools. Yeah. So they're falling through some cracks. So we look forward to working with those people and trying to make sure we're good partners for them too.
Specifically, what is your strategy to make the diagnosis happen a little earlier?
So, well, there's multiple prongs. One thing we do is we try to educate the medical community. So we actually train every single student through the Case Medical School. We actually train them twice during their stint at the medical school. We also train every single resident that's coming out of the Cleveland Clinic residence program. So we're trying to get to the medical providers to let them know that unconscious bias might be there. And then we're working with the families on language and having the confidence of saying, no, don't say to the doctor, oh, I think something's a little slow. Like, say, I'm not noticing him making sounds that are, in relation to things he needs. So giving them more of the language where, unfortunately, physicians want to hear that language and may not have the tools. So those are two of the kind of prongs. And then also a lot of what Selena is doing is trying to make people aware that it's okay to have a neurological difference. A lot of our families are concerned of giving their child that label, and she's trying to bring some awareness that with that label can come supports that'll really help. It's not just creating a stigma for your child.
Okay. Thank you.
You had a question about the longevity of with Cleveland schools?
Right.
So it's interesting. We used to do school team training for about a 5-year period, and we worked directly with the special education staff of CMSD to create that program. And I think it ran in the 2000s for 5 years. So we've been working with them in an ongoing way. This past year, for several years, we've been working on scholarship opportunities to attend the conference, working directly with the special education staff for families to go and for educators to go. The other way we are engaged with them is our planning committee. So to develop the conference, we have a conference committee including staff from the variety of schools, including CMSD, so that they can participate and tell us what they're looking for, what would be helpful for their staff.
What does the working relationship look like between you and the linkage coordinators in Garfield and Warrensville? Can you help me to?
I'd have to talk with Selena and see. I know we've been working with the transition coordinator at Warrensville, with the special education and people services director, but the linkage coordinator, I'm glad you're mentioning it, and we'll look into specifically with that. We actually just were approached by the YMCA in Warrensville because they're interested in providing some services for families with special needs. I think what's really nice about having these 2 pilot projects is we're trying to really focus there and go deeper. So working with the schools, with the security and first responders, because people are out in the community, having this addition of the YMCA, I think it's a really nice way to gain presence and have everyone learn about autism and be able to direct people appropriately.
Great, thank you.
Councilwoman Brown.
Thank you very much, Chairwomen. For the question I had was with regards to the digital divide that Councilwoman Conwell spoke on. As it relates to that, and you talk about our seniors, we have the Department of Senior and Adult Services. Do you work with them? Mm-hmm. You do not? Okay. And just was looking over the Milestone Board of Directors and was just curious. I see we have some representation of individuals of color, but just curious as to what are the requirements, or how does one become a board, the director on the board?
We have a board leadership committee that we work with to determine what are our needs on the board, and that would include a variety of skills and experiences that we're looking for. Having diversity on our board, on our committees, on our staff is a value that is very important to us and is part of the conversation as we're looking at new board members. We try to have a committee of diverse individuals from different backgrounds, geographic, ethnic, gender, as well as I said, those 3 categories of family, professional, working with autism, and the general community. And we've worked to address all of those different elements. It is important for us, as we want to make sure that we're serving the broader community and that the broader community is represented on the board.
So the term and how one would become a board member.
3 years is each term. People can be elected for up to 3 3-year terms. The process has been that we take a look and see who's engaged with us already, who has a potential interest in autism. We talk with board members, staff, and our committees and request suggestions. Sometimes we are looking, again, we're looking for someone, for example, who works in the Hispanic community, and turned to our board members from the different hospitals to see who they might recommend, just as an example there. And people, on occasion, people will indicate to us, I'm very interested in getting more involved, and the first step for us would be to meet with them to see what they're interested in and to connect them to a committee and see how that works in terms of them getting to know us and us getting to know them, so to see what skills they have so that we can move further along in terms of joining the board. People join the board each year in August, September.
And are your spaces of board members complete? Are there any vacancies?
We are looking now for August, September 2020.
Okay,
We
because
did-
what I have noticed is that it doesn't appear to have any African-American males on the board.
That is correct. Not for lack of trying, but that is correct.
Okay, all right. Okay, well, there's a call out there to the public.
That's correct.
All right.
That's
there you
correct. I've actually invited 2 individuals I've worked with over the years, and they have declined. And one of whom is a parent of 2, is a leader in the community, and another who is a community member. I continue to meet with them to ask for suggestions and welcome suggestions.
go. Mr. Tarter?
Thank you, Councilman Brown. Councilman Miller?
Madam Chair, Director, first I want to thank you for this very important service that you're providing. And autism is sometimes somewhat of a stepchild that kind of falls in between mental health and developmental disabilities, and I think this sometimes creates some difficulties in accessing services, so I think you have a very important role to play. And so my question is what your total annual budget is and what the funding sources are besides Cuyahoga County.
Thank you. I appreciate your comment about mental health and autism, and it is a concern and something that the fact that we have mental health counselor on staff is very helpful because she's both trained in mental health challenges and autism. So you are correct that that's a significant issue for families. Our total budget is between $1.2 and $1.3 million. We do have income from our services, from the conference that we put on. People do pay registrations. There are exhibitors and sponsors for that. About a quarter comes from grants that are from foundations. The council funds, you can see, is a relatively small percentage of that. We do have annual fundraising, a benefit annual fund, and a bowling event that also supports. And we have an endowment fund at the Cleveland Foundation, which is under $400,000, and we do have some income from that, the interest from that.
And how long has your organization been in existence?
We were founded in 2003, and we're about to host our 18th conference in June. So we were founded in 2003 and had a conference that same year.
Okay, thank you.
I want to tell you what's in your packets. There is a summary of 2018, which is a breakdown of the requests that we get. And you see that we have information over the last few years. The information for 2019 actually is going to be between 550 and 600, we anticipate. We can send that to you at the end of the year. A number of calls, the cases are for help desk, a number of them became consultations. So although it's a similar number altogether, it reflects as a little bit less than help desk and a little bit more on consultations because people needed more in-depth help and they were referred to consultation. And it shares with you what the the 5 top topics are of why people call us. And on the back it has the breakdown of where people come from. There's also a listing, bios of each of the help desk staff, our board of directors, a general brochure, and these are our help desk calls, help desk card, which indicates support is received from the council. And you had a question, I'm sorry.
No, we're good. We have another meeting starting at 3, so I think unless there's any questions, I was going to wrap up, but Councilman Jones?
Just one
So
comment.
quickly.
Thank you.
As you investigate the linkage coordinators, just to give you a little understanding, Warrensville and Garfield Heights have contracted with a company, Students of Promise. The director is Bob Ivory. That would be an ideal person. You may already have that working relationship, but if you are in separate silos, it would be great to make that connection and just strengthen your working relationship there in the schools.
Thank you. Thank you. And we'll send you everything by email that was requested.
Thank you so much for a thorough and enlightening presentation. And unless there's further ado, I don't have miscellaneous business. I don't know if my colleague does. Nope. So we're going to adjourn the meeting. Thanks, everybody.